us. Dr. David Smith is a DVM, a PhD, a DACVPM epidemiologist. Will and I were inundated.
What do all those mean?
It means what did Jerry Clower said? You're educated beyond your means. And I know it's not you, sir, but it was Jerry Clower. So.
That means I'm the field trial dog of veterinarians, I guess.
Listen, I want to ask you about this, and I thank you for joining us because this thing, ivermectin, Will and I and everybody in this audience, we learn things. We hear names like the hydroxychloroquine, and over the years, we learn more each day on this one. But on ivermectin, your thoughts on this one, and where are we now with this bit of controversy? Because it was it available for veterinarians before humans or about the same time? A little bit of the history on this particular drug.
Yeah, so ivermectin is a really powerful, very useful anthelmintic. It treats parasites, the intestinal worms and some external parasites like lice or mites, and it's been around for probably 35 years. It's very important for livestock production. People use it for the same purposes. So in particularly in developing countries where they're challenged with external parasites and internal parasites, that this is an important drug in those places as well for people.
How did we, Doctor, how did we make that leap from parasites to a virus and kind of eradicating that? And was the leap made by just amateurs out there, or was it actually made by MDs?
No, excuse me. I think that there's some research behind it. There's been some studies, but they're not. This idea that there might be antiviral properties is relatively new, and there is no labeled indications for antiviral uses for ivermectin anywhere that I know of. There are some researchers that are beginning to conduct some studies. Many of those are in the laboratory. They're not even in live animals.
When we come to veterinarians, Mississippi State's one of the foremost universities in this country, and we start looking at this one. Just a little bit of a history. How is this? How do you guys, as far as the medicines and everything that you use there, they don't have to be approved by the FDA. What's that process? How does that process go?
Oh, they do have to be approved by the FDA.
They do, even for the animals.
Even for the animals, they actually go through a more stringent review by the FDA because we use them in animals that are intended for food. So when you look at a label, for example, if you looked at a label of ivermectin, it not only has the dosage for the animal, there is also what's called a withdrawal period, which is they've had to determine how long does it take before that drug is out of the animal before the meat or the milk or the eggs are safe to use. So they go through a more stringent review process because of that.
I would imagine this is the commonality from several drugs like that, isn't it?
Would be true for all of them. Yeah. All of the drugs, any of the drugs that are used in food producing animals have to also demonstrate that their residues are not going to be in the animal when they're harvested.
With all of the training that you have had, what would you say to people in this audience across the state who were just thinking about it this morning? Maybe this would be a great idea. What would your advice be?
Well, these are drugs that have been tested and approved for use in animals at concentrations that are appropriate for the animal. We use these ivermectin. We're talking about ivermectin. So
right.
We use these. They're approved for use in cattle and horses and pigs, and those are large animals, and the dosage formulations are made for those animals. And there is an ivermectin that's approved for people, and you can get that from your physician. Your physician, if he thinks it's a good idea, can prescribe that. Probably not.
Go ahead.
No. Well, probably not the farm store as your ideal source of information for treating yourself for.
Well, it's kind of like going to Home Depot for your Botox equipment, or supplies. I do want to ask: is the ivermectin the same thing though? Is it the same formula that the MDs would use, that the veterinarians would use?
The drug itself would be the same, but within those formulations, there's also carriers. So there are injectable products, there are products that you can take orally, and there's products that you can apply to the skin in veterinary medicine. The same thing is true for people, but those carriers might be different.
But doctors have been prescribing it for years, as far as for humans.
Yes, for parasitic infections, not for viral infections, but for parasitic. Yeah. It's got a label. It's been approved for that.
This is not really the first time we've had that crossover. I was thinking about earlier, and I think Will and I were talking about this yesterday. The shampoo, the horse shampoo, took off in beauty circles as far as people using that. But as far as medicines are concerned, this is not the first time that we've had people saying, I can get this pill for $2 and this other pill's $200. But that's been around for a while.
The thing about veterinary medications are that some of them are really dangerous, and so we prescribe some drugs that have a specific purpose in the animals, but they're very dangerous to handle. And they usually come with a veterinarian warning you about being careful about handling these. There are some drugs that if you injected yourself, you could die. And so the idea of deciding that, well, I can save a few bucks by going to the farm store and getting an animal medication, that could be dangerous. The other thing I want to say, it's kind of important to recognize that veterinarians are not prescribing these drugs either. These are drugs that are available over the counter. Ivermectin is available over the counter at the feed store. So it's not veterinarians that are prescribing this for people. It's people that are able to buy these drugs over the counter.
Are there name brands, in certain name brands that it's coming in, or?
Oh yeah, there's a number of them. It's available in generic formulation. So there are a number of brands that are available. Yeah.
I don't even think I want to mention the brands because we'll have it's a good thing you're not at the convenience. I was going to say that's the only thing that's not at the convenience stores now. It's going to be at a gas station before you know it. But are these applied topically, or are they injected, or consumed? You drink them, or what?
Yeah, well, all of those things. There are formulations for injecting. There are formulations for putting on the skin, and there's formulations that are oral medications.
It's amazing.
The other place that your readers or your listeners might be familiar with ivermectin is that it's a common one of the drugs that are used for heartworm prevention in dogs. So they might look at their heartworm preventive and see that it's got ivermectin in it.
Dr. David Smith at Mississippi State University. Listen, while I got you on, have you seen or have you heard, or are you guys doing any studies at all, a transferal of COVID over to the deer population?
There's been a lot of concern about COVID crossing into a number of species, and it has. There are some ferrets and mink that have transmitted it, been infected with it, and caused clinical signs. So there is some. This is what we call a zoonotic disease. It does affect some animals. It may have originated from some animal in the first place. So yes, there is. I'm not aware of any work done at Mississippi State on the topic, but it certainly has been found.
You haven't heard of any as far as family pets, to your knowledge?
No, we've had some concern about, in particular, cats for a long time. Cats that come in with respiratory infections, we've handled with a lot of caution because of the potential that they could be shedding. And there have been cats and dogs that have been infected with COVID when their owner patients have been infected.
About that. It's great to spend some time with you, sir. Appreciate it. Love to have you back on, and I thank you for joining us.
Yeah, I appreciate the opportunity. Thank you, Paul.
You got it. Thank you, sir.